Ear, nose, and throat come together and look after the front of the face and the ear. The ear is the most fascinating, of course, because it has two functions. It has the function of being able to hear things, so it's got its little eardrum and the ability to listen to sound waves and pick them up, but it also has the middle ear, which is responsible for balance. So the common problems you can get with the eardrum is you can get infection, particularly in children, where the tube that comes from your mouth to your ear, because of the shape of a baby's head, is more straight, and as a result of that, infection can get from the mouth into the ear. So young children can have a lot of problems with glue ear, which is just inflammation, and they sometimes need a grommet or a little, which is basically a little drainage mechanism to allow the fluid to drain out. Meniere's disease is where the canals that allow you to know whether your head's sideways or not, they become inflamed. It can be from a viral infection. Sometimes it's not clear, and that can lead to problems with balance. And of course, tinnitus is where you hear buzzing all the time, where the receptors in your ear can become affected. Rarely you can get tumours in the ear, and they have to be dealt with by the ear, nose and throat, or the ENT surgeon. And the most fascinating development in terms of the ear, nose and throat specialists in the last 20 years has been the cochlear implant, where people who are deaf can have an implant which allows them to hear. The throat, tonsillitis, where the tonsils, which are your first barrier to infection in your mouth, can become chronically inflamed or over-inflamed, and they sometimes have to be removed. And of course, the vocal cords can become damaged, but fortunately not very often.